what do we do about treatment? So how do you go about saying, okay, well, this patient, this is something we don't need to do anything about. We just need to monitor and have you come back in 6 months versus saying, all right, we should probably start bracing. And then do you do bracing all day or is it just nighttime? Or, can you kind of go into the treatment of this?
Yeah. So as far as treatment's concerned, the most important thing is, like we talked about in the beginning, is the kid growing or is the kid not? If the kid is growing, you have to be a little bit more concerned because things can get worse. Scoliosis is the disease of the growing, really. And once kids are done growing, progression, if it happens, is going to happen much more slowly. So that's really the most important thing, growing or not growing. Number two, I think, is important. How big is the curve? Is the curve greater than 50 degrees? If a kid is done growing, but that curve is greater than 50 degrees, we know that that curve is going to progress throughout that kid's lifetime, approximately 1 to 2 degrees a year for the rest of their life. And so that's really important. If it's a small curve and it stays small until a kid's done growing, less than 50 degrees, highly unlikely to progress a lot more. But 50 degrees tends to be right about that cutoff where we think, you know what, this is going to get worse and we probably have to do something surgically about it. And so as far as how do we prevent curves from getting worse, in that growing kid that we talked about, if we notice that the growing kid has a curve that is progressive, if I see that kid and they have a 15-degree curve, but the next time I see them, they have a 20 to 25-degree curve, then I know that this is progressing as the kid grows, and we're going to have to try to do something to modify the progression of that curvature. So Stu Weinstein, former president of the AOS, former president of Scoliosis Research Society, former president of Pediatric Orthopedic Society of North America. So really accomplished guy, really nice man. He wrote a paper, I think it was in 2013 or 14, that was published in New England Journal of Medicine, an actual real medical journal, not our medical journals. It was so important. It got published in New England Journal, but basically saying that bracing works. It was a prospective semi-randomized trial that looked at patients who got a brace versus patients who didn't get a brace. Those kids who got a brace were much more likely to prevent surgery than the kids who did not get a brace. And so the stuff that gets tested on this is, number one, do braces work? Yes, they do. But number two, how long you wear the brace is really, really important. So the key number is a patient must wear the brace at least 12.9 hours a day, or 13 hours just around, at least 13 hours a day to have a 90% or better chance of preventing curve regression to surgery. And obviously, the more you wear the brace in the day, the less the chance that you will need surgery. So if you wear it up to 17.7 hours, or let's round it, 18 hours, then your chance of progression to surgery is less than 6%. So 94% chance of preventing surgery. So those numbers are critical to know. You need to do at least 13 hours a day. So when I see a kid like that, I don't tell them, hey, you can wear it 13 hours a day. I tell them, wear it as much as humanly possible. Let's shoot for 20 to 22 hours a day. So let's say they cheat and they only wear it, oh, Dr. Cho, I'm so sorry, only wore it 18 hours today. In my brain, I know, you know what? I still have them at a point where they're wearing the braces a lot, and it's much more than those thresholds, 18 hours or 13 hours.
Yep. I realized that one time I was and this is totally different type of thing, but just as far as overshoot so that you can expect for them to kind of undershoot what you say and they still do fine. I remember I was in high school and I was over putting together this class trip. And when it came to getting the money, I would always tell people that I need the money probably at least 10 to 14 days before I actually need it, because every time they're going to, every chance, half of them is going to be a certain percentage that will not get it to you on time. But if you give them some room for error, they still end up making it just by chance. Like if you would have told them the correct date, they would have messed that up too. But if you give them a little room for error, I think that really helps in it. In this particular topic, I always thought, that young teenage girl, she's 14, 15, going to high school, going, she don't want to wear that brace. It doesn't maybe look as cool as she might want. So I definitely think it's probably really hard for them to stay in that brace as much as they should. So yeah, definitely give them a much bigger, larger goal than what they actually need is a great idea.
For sure. And then how do we kind of measure compliance on this, or like how much they're actually wearing it? We use thermal sensors. So if they wear it, the sensor will detect that it's on. And if they don't wear it, then detector detects it's off. And then we can download the data through a USB port. So
Oh wow,
we use the
I did
thermal
not know
sensors.
that.
They're really good. Yeah. And they're not that expensive. And it basically, we can know whether or not, they're telling us the truth. Most kids are reasonably honest, but about wearing the brace, but they usually get the times wrong. They'll say, you know what, I think I'm wearing it all day. It's like, well, actually, you're only wearing it, 17 hours a day. It's like, oh,
Yeah.
like I thought I was wearing it
Huh.
more. I thought I was wearing it 22.
Yeah.
Um, and then does it correct scoliosis? We don't say it corrects scoliosis. It holds scoliosis and prevents it, hopefully, from getting worse to that 50-degree threshold, which would require surgery.
Absolutely. I think that's a good distinction to make clear to the patient and the parents. Like this is not going to make the scoliosis go away, but we're hoping that this, does not make it work, helps it not progress. So just
Yeah,
something.
and I just leave it. I leave it on them. I say, listen, I love doing surgery, so if you don't want to wear the brace, that's cool with me. Like
Yeah.
I'm happy to do it. And usually that gets the parents to laugh, and it puts the onus of responsibility on the patient. To say, you know what, if I don't want surgery, this is really the best way to go.
Absolutely. And before we get into the operative management, can we just kind of mention what patient group are we just kind of watching closely for a while?
Yeah, so kids with, so basically any kid that's growing with less than a 25-degree curve, I'm going to be seeing them about every 6 months with a PA and lateral standing x-ray. And the reason I want to do that is I just want to make sure this kid's not going to have a progressive curve. But kids who are growing and have greater than 25-degree curves, those kids are probably going to be in a brace of some type. And those kids I also see every 6 months, but I usually take those x-rays out of the brace to see what the curve progression seems to be. I also tell the kids the night before, you get to not wear your brace to sleep, and you get to not wear it until I see you in the clinic, but bring it with you. And the reason I do that is because sometimes the brace works reasonably. If it works really well, it can give you a false sense of where the spine is, because it's kind of holding them up. Your back's used to it, and if you just take it off right before the x-ray, sometimes it gives you a false sense of security. So that's really critical to take it off the night before. And then on the older kids, if the older kids have, let's say, less than a 50-degree curve, then I really only follow them up every so often just to make sure they don't have any progression. But if a kid's completely skeletally mature, let's say, with a 25-degree curve, I say, good luck to you, maybe get an x-ray every 5 to 10 years just to make sure. But, it's highly unlikely to be progressive.
Yep. And all good little technical pearls to keep in mind